Urinary incontinence in females is a very common problem. Urinary incontinence is twice more common in women than men. 1/3 of the women over the age of 60 are estimated to be incontinent. Basically, there are two types of incontinence: stress incontinence and urge incontinence. In stress incontinence, a small amount of urine leaks when a person is sneezing, coughing, laughing, or having any activity. This usually occurs because pelvic floor muscle gets weaker and no longer supports the sphincter. In women, pregnancy is a common reason. During childbirth, these muscles get overstretched. In most cases, this condition can be treated with exercise. An urge incontinence patient is not able to hold urine urgency. Causes may be an infection or neurological disorder or diabetes or spinal injury. Usually, it is associated with increased frequency. They have to get up frequently at night to pass urine. In mixed incontinence, she may have both type of symptoms. Cause of urinary incontinence are urinary tract infection, constipation, pregnancy, childbirth, menopause, tumor or urinary stones, spinal cord injury, neurological disorders, etc. If urinary incontinence is affecting your daily activities, don't hesitate to see your doctor. For most of the cases, lifestyle and dietary changes or medical care can treat symptoms of urinary incontinence. For stress incontinence, drugs are usually not effective, and patients require intensive pelvic floor muscle exercises to strengthen pelvic floor muscles. If no desirable results are seen, then the person may require surgery. Limit fluid intake at certain times of the day, such as before going to bed or before a long trip. Increase fiber content in your meal to prevent constipation. Cut down on caffeine, alcohol, and keep a healthy weight. For bladder training therapy, urinate at regular interval. Gradually increase the interval between urination as you gain control. Try pelvic floor muscle exercises such as Kegels exercises. This is to strengthen the muscles that support the bladder, and particularly recommended after childbirth. Small leakage can be managed by wearing menstrual pads. For stress incontinence, topical estrogen may be applied as a cream or patch. A ring-shaped medical device can be inserted into the vagina to hold up the bladder neck. The ring needs to be taken out and cleaned regularly. Bulking agents such as collagen and carbon-coated beads can be injected into the area surrounding the urethra to support and keep it closed. It has to be repeated to be effective in the long term. A small pulse-generated device is implanted under the skin of the buttock. The device sends mild electrical impulses to the sacral nerve, the nerve that controls bladder activity. Bladder suspension or sling procedures may be performed to create artificial support for the bladder neck. Kegel exercise is the best natural way to control urinary incontinence. It strengthens your pelvic floor muscles. Anybody with stress urinary incontinence can do this exercise. It is also beneficial for men having incontinence after prostate surgery. Contract the muscle of the pelvic floor like you are trying to hold urination. Try to hold it for 3 to 4 seconds and repeat it 10 times. Perform such kind of 3 sets in a day. This exercise can be done at any time of the day, while sitting, sleeping, at the office, while watching TV. Make sure to do the exercise correctly. Don't contract abdominal muscles or buttocks muscles. With practice, you can do it correctly. Do it for 3 to 6 weeks daily to get some results. It may take as long as 6 months to show the result. When your pelvic floor muscles are in shape, they'll contract more strongly even during an orgasm. For any health-related information, visit wellness4free.com. Like, share and subscribe.